Shingles. It's a diagnosis no patient looks forward to. Marked by a painful rash that lasts 2 to 4 weeks, it's caused by the reactivation of the varicella-zoster virus, better known as the chickenpox virus. But once the rash subsides, there is a lesser-known, long-lasting possible complication, post-herpetic neuralgia, or PHN. I'm Dr. Jamie Rutland, and I've invited my good friend, fellow pulmonologist and critical care specialist, Dr. Chase Hall, to discuss this condition and a population at risk, the immunocompromised population. Dr. Hall,
Hey.
Are you there?
Hey, Jamie, I'm here. Both you and I see a lot of patients that are immunocompromised, so spreading awareness about shingles and post-herpetic neuralgia is vital.
I absolutely agree. While anyone previously infected with the varicella-zoster virus can get shingles, these patients are an incredibly vulnerable population and are at greater risk of herpes zoster and its complications. Not only that, their symptoms can be more severe.
Exactly. You know, I have a 72-year-old female patient with connective tissue disease-associated interstitial lung disease, or CTD-ILD, who's on immunosuppressive therapy. She recently presented to urgent care with severe pain extending from her toes to her pelvic bone. You know what they diagnosed her with? An ankle issue.
Wow.
And advised she take over-the-counter pain medication. Herpes zoster might not be at top of the mind absent the rash, but as you know, patients can have prodrome symptoms.
That's a misdifferential diagnosis for sure. CTD-ILD is more prevalent in women, and so is shingles.
Absolutely. Because guess what? 5 days later, she presented to the ER in extreme pain. By this point, the characteristic shingles rash of fluid-filled blisters had erupted over her entire leg and pelvic area. Antiviral treatment was started and the rash subsided, but she continued to experience severe pain that persists to this day, 3 months later. She had developed post-herpetic neuralgia.
You know, is PHN something you see often in your practice?
It's more common than you think. Around 10 to 18% of patients will develop PHN, and both risk and severity increase with age.
What do patient outcomes tend to look like after a diagnosis of PHN?
Well, in the case of my patient, with proper management, her pain improved over a few weeks, but it's still there. She continues to be controlled with medication. Studies have shown in many patients, pain from PHN may persist for several years.
Shingles is rough, but post-herpetic neuralgia can make it even worse. Can anything be done to prevent PHN and improve outcomes?
Prevention of herpes zoster is the only well-documented means of preventing PHN. Once a patient develops shingles, early detection relies on recognizing the characteristic painful rash and initiating antiviral treatment promptly. Patients with severe pain or extensive rash should be monitored closely for the development of PHN.
Thanks, Chase, for sharing your patient's experience and giving us more insight into post-herpetic neuralgia.
You bet, Jamie. We'll see you later.